lot of people don't realize sometimes we treat those things electively, meaning a migraine or a family history of brain aneurysm. So my primary care doc got a screening MRA for me, and holy cow, I do have a brain aneurysm. About half my patients meet me that way. They come to the office. Actually, they're terrified when they come, but they're not having any issue. We go through that brain scan and we talk about treatment options. So for example, if it's a brain aneurysm, the two main forms of treatment are open surgery, which is a very good surgery if one needs to have it. But thank goodness, over the last 10, 15, even 20 years, the minimally invasive technology has become so great that the overwhelming majority of time we can treat brain aneurysms, if they need to be treated, minimally invasive, usually through a blood vessel in the groin or in the wrist, just like someone having like a heart cath for having a heart stent put in. All the blood vessels in our body are interconnected. So we're able to access that artery by putting in basically a special IV. It's called a sheath, but it's a specialized IV into that artery and threading those long, thin tubes, catheters, all the way up under X-ray guidance. Instead of having them go into the blood vessels in the heart this way, we simply follow a roadmap that leads up into the brain, and the teeny tiny catheter enters into that brain aneurysm. And since the other end's outside the body, we're able to push through it these very tiny, delicate platinum coils to fill that aneurysm or bubble inside of it with a basket of coils. And those coils stay there. And once it's filled with coils, you could imagine the blood can't possibly get in there anymore. There's no room for it. So it protects that aneurysm from ever bursting. So it's great that we can do, basically, I tell my patients, we do brain surgery from the inside out. When you wake up from your surgery, usually you don't even have a headache. Maybe you have a little soreness at the wrist or the groin, maybe not. And you usually go home the next day. I'm calling you to remind you, hey, you just had brain surgery from the inside out. So it's lovely that we can do that.
No, that's amazing. That's a great explanation of both the different types of stroke and the way they're treated. I think, especially those that are in this situation where they might find the aneurysm before the rupture. So many obviously questions arise. I've never heard it called like the brain surgery from the inside out. And that's kind of an amazing way to think about it, and speaks to obviously the incredible advances in the treatment of brain aneurysms over the past 20, 30 years.